All right. Well, I know everyone's getting situated, so welcome to those of you who have joined. We're going to get started. A few quick housekeeping items. I'm Jen from Calcium, and we'll be hearing from our guest speaker, Jordan Dolan, today. As we get started, I'd welcome you to use the chat window to your bottom right of your screen, where you can introduce yourself. Feel free to share any questions that come up during the presentation or things that you even came to today's webinar with questions about. We'd love to tackle those during today's discussion. We also have a number of team members on that would be happy to discuss your question or comments as well. So we encourage that throughout, and would also just welcome you to share, and chime in if there are particular areas that in your organization would be well suited to leveraging patient engagement, with that being today's theme. So again, thank you for joining. And all that said, we'll go ahead and jump in. Today's webinar is if your outcomes aren't improving, your patients aren't engaged. And our guest speaker today is Jordan Dolan. Jordan has been very much of a leader in the patient engagement space. He's the founder of Emmy and brings to us a lot of background between startups and in the technology space. So Jordan, we're excited to have you here. And without further ado, we'll let you introduce and jump on in.
Great. Well, thanks for having me, and thank you for everyone who's attending. And as you had touched upon, my background is in patient engagement. I started the first patient engagement company, or one of the first, 21 years ago. So I've been in and around this space for a long time. And just to touch upon the title and the theme, patient engagement can work. It does work. It can change outcomes and improve all sorts of things, economics and clinically. So if you're not seeing those results, then you're probably not actually engaging your patients. So with that, we'll dive right in. And again, I hate to share with people things they already know, but I also feel like if I didn't share it, it would, you need this as a starting point. And they taught me in graduate school that if you tell people things they already know, then you appear smart. So as you all are aware, the US healthcare system is broken pretty much on every single level. We spend more than anybody. Our administrative costs are 3 times higher than the next closest nation. And most of our health outcomes are trailing, well below 50%. Things like controlled asthma, controlled hypertension, controlled diabetes, infant mortality, on and on and on. And we have the highest percentage of our adult population with one or more chronic conditions. Where we really stand out is in terms of obesity. We are the heaviest country on earth. And we have the lowest utilization of wellness and preventative programs anywhere in the world. And the reason I point that out is because it's really key to bending the cost curve in the future. And that is, we need to focus on wellness and prevention. To put that in perspective, 3/4 of all the dollars spent on healthcare go towards treating chronic conditions which are avoidable. And it's a theme you'll see throughout this. So if you can flip to the next slide. I'm sure you've seen lots and lots of diagrams that say the same thing as this, but I find that they're very effective in explaining how we got into the situation that we're in terms of our healthcare industry. And the reason we are where we are is because we're spending too much money on the care part and not enough on the health part. Oh, Frank, I think you got to go back to mute. I'm hearing weird things again. Oh, perfect. Okay, went away. So if you look at the adult population in the US, it's about 210 million. Roughly half are healthy, and the other half have one or more chronic conditions. But down at the bottom, about 7.5% of the adult population consume 80% of the resources. So all of the money in healthcare is the high cost treatments are going to a very small number of people. And that's how we ended up in this situation. And what's driving this is the fee for service mindset and compensation models of healthcare. So they got us here and they keep us here. So if you go to the next slide, just to kind of put this all in perspective, if you look at when I talked about going from lower cost to higher cost, according to the American Heart Association, 70% of all heart disease can be treated with diet and exercise alone, not even medicine or procedures. But now as you look at this, what are your options to avoid heart disease? So getting an annual physical is about $100. If you hired a nutritionist for 6 weeks to change your diet, it's $240. If you joined a health club, maybe a little bit over $1,000. If you hired a personal trainer for a year, $100 a week for 48 weeks, take a few vacations. All of these pale in comparison to the treatments for heart disease. And they range from $42,000 to $193,000. So this is why the value of spending on preventative and wellness and the fact that we don't do it, this really drives home the point. So you can go to the next slide. So, it's everybody seems to understand how we got here, and people have been trying to fix it, and it's not getting any better. And the reason is it's the way the economic structure is set up, and that is the more that you do to the patient, the more money you make, rather than the healthier the patient, the more you're rewarded. So the fee-for-service structure has created an economic model that drives these behaviors, and the majority of the money goes towards treating the sickest people, and therefore a very small amount of money is left over for preventative care, wellness, routine screenings, all of those things. And that's what's gotten us to this point. And what I found really interesting is that, just to touch on that theme about how much of our healthcare dollars are going towards treating these chronic conditions, I looked for the most recent data I could find, and 99% of Medicare dollars are going towards treating avoidable but uncontrolled chronic conditions, and 83% of Medicaid dollars. So the attempts to fix this have all been about cost cutting. So we've got a handful of people having very expensive care, but we've now tried to squeeze the dollars out of that care. Reimbursing hospitals less, it just doesn't work. You can't cost cut your way out of a broken model. The entire industry needs to transition to focus on the people at the top of that funnel. So if you go to the next slide, and this is what I mean. So, and these are actual people with prediabetes and diabetes. I've looked them up from websites that claimed to be accurate. But if you think about it, a person with prediabetes who actually cares about their health is getting annual physicals, talks to their doctor. The effort and energy and resources required to change that person's behavior are fairly reasonable versus somebody who's got full-blown diabetes with all sorts of complications, who's smoking, drinking, overweight. You aren't going to change that person's behavior. So, imagine a grandparent you have who smokes too much, drinks too much, swears in front of your kids. That person isn't going to change versus somebody who's younger and maybe is on a path towards poor health. You have a shot at turning around their healthcare before they start incurring these huge costs. And you can go to the next slide. And as Jen shared at the beginning, please feel free to jump in with any questions along the way. So we know that trying to do more of the same, but simply lowering the cost, absolutely doesn't work, nor does fee for service. Fee for value is the only way out of this. And again, people have different names for it. High value healthcare, fee for value, shared savings. They all mean the same things. You're providing economic incentives to reduce the prevalence and impact of chronic conditions. So let's just say we've got, 10% of the population who have chronic conditions and lots of complications. You can't really reduce that number and move them back up into the healthier part of the spectrum, the best chance you have is preventing the onset of those chronic conditions, or once people have them, to minimize or maximize the time between onset of the disease and costly complications. So, for example, people with type 2 diabetes, I don't know how many years it is between initial diagnosis and serious health complications, but it's a while, maybe 10 years. But with the prevalence of type 2 diabetes increasing dramatically, if you could stretch that from 10 years to 20 years, or people with high blood pressure, if you can start to control it, what you're going to do is reduce the number of patients who slip down that continuum and end up having all these, costly hospitalizations. So it takes time, and transitioning the industry, an entire industry, won't be easy. But the good news is that, most of these conditions, the treatments are well known. Clinicians know how to do it. They just can't afford to provide the hands-on care that they want. And there's a lot of economic reasons, and that, the sicker you get and the more serious your condition, the more lucrative it is for the specialists who treat you. So a primary care doc probably makes only 10% of what a heart surgeon makes, maybe less, maybe 5%. So the problem is that you got to sort of redivide the pie up of who makes what in the provider community, so that more resources are available to the people who can, help prevent these things. But at the core of all of them is patient engagement, because every type of program to change behaviors and get patients to take a more active role in their care require some type of technology platform to do it. And it's really intuitive, because it saves a great deal of time for patients and providers. And by automating sort of the more mundane tasks, clinicians can spend more time interacting with their patients in a meaningful way. Hopefully that all still makes sense. And we can jump on to the next slide. So, in my opinion, patient engagement is an economic imperative. And that's not to say that I'm promoting, you need to go and do this or, do that. The point is that without patients taking an active role in their care, we're never going to bend the cost curve and fix the health system. However, I know that engagement can work, it does work, it will work, but success in the provider community is going to require significant changes in aptitude and attitude. And what I mean by that is you need to learn what patient engagement is and what it isn't, and change the attitude around the service orientation of healthcare, which it really needs to be. Okay, we can jump ahead. What's really has been disheartening for a long time, and it's gotten worse lately, is that simply saying you're engaging your patients and actually engaging them are completely different things. You've got a ton of vendors who've taken the same solution they've had forever and ever, and they just started calling it patient engagement. The first ones to do this were the patient education vendors. Patient education is a passive document meant to inform, not meant to change behaviors. So you can't take what you've always done and slap a new name on it and expect it to achieve a different result, because it won't. Patient engagement is a new science, and it's based around a lot of disciplines that didn't even exist when I had started my company, ME Solutions. The internet couldn't handle the amount of data required to do interactive media. Things like the universal precautions and how to communicate and understanding the importance of health literacy and cultural sensitivities, none of that existed. And all of these things are relatively new, certainly under a couple of decades, but they work extremely well. So unfortunately, there's too many people who have no concept of how to engage patients or have ever done it, claiming to be experts. And I read something the other day, I think it was from CMS or IHI, one of those groups. It said that the word has now been so overused that it's used so broadly to describe so many things that it's beginning to lose validity, which is sad. So you can call it whatever you want, but the idea of building something from scratch with the goal of partnering with patients, engaging them in their care, and ultimately changing their behaviors is absolutely doable and attainable. And I know that because I've been doing it for 2 decades. But keep in mind, if you want to be successful at it, you've got to incorporate a lot of things: health literacy levels, cultural sensitivities, patient preferences in terms of methodologies, timing. Patients want to be engaged on their own terms, plain and simple. You have to learn how to communicate across multiple modalities. You've got to deliver the information during a teachable moment, all of these things. And they all center around this concept of human-centered design, which is another new discipline. But patient engagement really depends on it. And that term didn't exist when we started Emmy. And we then sort of became known as, experts in this field. We didn't set out to do that. We used a lot of the disciplines that came from marketing and advertising, using focus groups, testing results, seeing what works and what doesn't. So it was a logical process. But at the end of the day, talking about it doesn't matter. All that matters is, are you achieving the results? So with that, you can go to the next slide. So as I had mentioned up front, if you do it right, there's overwhelming evidence that it will bring you clinical and financial improvements. So there's a tool called PAM, which stands for Patient Activation Measures, widely available. So you can track how engaged your patients are, and you can then track their health outcomes. And there are hundreds and hundreds, thousands of studies showing the impact of patient engagement. At Emmy, we had a research department. So we were all about changing behaviors, changing outcomes, and measuring it. So from its founding till when I left, we had conducted over 200 studies. And, half were financial, half were in peer-reviewed journals. And I mean, we studied this stuff up and down. And, you can look this stuff up, but they're on the chronic condition management side. There's studies showing improvements with hypertensive patients, with diabetic patients, with asthmatic patients. There's studies showing improvements in routine screenings, colonoscopies, mammograms, all of those things. Diabetics reducing their A1C scores, up and down. And we had clinicians who would approach us saying, I want to study the impact of these things. And some of them were way out there, but fascinating. And the one that always comes to mind is, we had a clinician who said that the more activated you are and engaged as a patient, the less anxious you are when receiving care. So he decided to measure the amount of anesthesia required during a surgical procedure. And patients who had received one of our engagement programs required 20% less anesthesia, which reduced the length of time of the procedure, reduced risks and complications, and ended up getting their med mal premiums reduced. So when I say the impact of activating patients is far and wide, I mean, I can't stress that enough. So like I said, lots of data that is publicly available to show that this stuff actually works. Okay, next slide. The next key piece is understanding what the goals are. And these are actual things I found online from different vendors promoting patient engagement solutions. Now, the ones who are still in the fee-for-service mindset explain that, we sell engagement solutions, And here's what it'll do for you. We can reduce your no-shows, make your patients more loyal, attract new patients, improve compliance, facilitate communication and online billing. That is a tool designed to make life better for providers. That is nothing for patients. Now, the people who are working with, value-based entities, they're talking about activating your patients, helping you make informed decisions, changing behaviors, supporting your personal goals in terms of wellness and health, and creating care plans that will complement your goals, needs, lifestyle, all of that. So the orientation of these things has to be around the patient. And this goes back to what I was saying earlier, which is people are just taking the same old junk they've purchased and put a new label on it and said, oh yeah, this is patient engagement. But at the end of the day, we're living in the age of accountability, and health systems are going to be dinged for bad outcomes and bad patient sat scores. So, you can bury your head in the sand and say, oh, we bought this tool for engagement. Well, if it's not working, it's not working, and you're just throwing good money after bad by continuing to pay for it. So the next slide. And this is, to me, the cornerstone of what it's going to take to transform healthcare. Healthcare is a business, and healthcare is a service business. Patients have choices where they want to go, what they want to do, and there's a shockingly large number of individuals who are changing providers because they don't like the level of service. 50% of patients are reporting a willingness to change providers based on the level of service they're receiving. 96% of complaints that come into practices about providers relate to service levels. So I just want to highlight Judy Faulkner, the CEO of Epic. Her worldview, and she has fought tooth and nail to keep patients from having access to their personal health records. She threatened to sue CMS when they were opening up the interoperability thing. So this is a quote from her. Our experience has been that about 0.5% of patients have ever been interested in managing their own record. Then it falls off. They want the health systems to manage it. So I don't know where that comes from, but actual reality, which is documented on the right, and this comes from a recent Accenture survey, 87% of people surveyed want to control their own health data. So nearly 90% compared to Judy Faulkner's distorted view of 0.5%. People don't want that. And interestingly enough, 78% of patients want better access to these mHealth tools and resources. 90% are willing to share that information with their clinicians. 3/4 of hospitals think that these tools will improve care, and 93% of doctors think they'll improve care. And yet we've got a handful of people blocking these things. I would encourage all of you to do some digging around, information blocking. And I read an article recently that was great. I forgot who wrote it. It was some clinician, prominent doctor, saying that there needs to be accountability for people blocking interoperability. So the point is, when you hear people saying, oh, this isn't working and that isn't working, it's like, no, the tool you're using isn't working, but the ones that do work are out there. So if you go to the next slide, and this always comes up because I think a lot of people will come to the point, they're like, okay, you know what, you're right. We need to engage our patients. And we have a patient portal for that. Well, no, you don't. Yes, you have a patient portal. No, you don't have an engagement platform. So if you go to the next slide, at their core, patient portals are an extension of the EMR. EMRs were created to support providers and health systems and never intended to be patient facing. They're abysmal to look at, to use. I mean, clinicians hate them. Why? And they're forced to use them. It's a condition of employment. Why do they think that anybody who had the ability to voluntarily not use it would choose to? So regardless of what you may hear, the actual data around adoption is abysmal. That very, very few people are using their portal. So I had read, I have some stats here that 60% of patients report being offered access to to a portal. 20% ignored entirely. 20% sign on once or twice and never go back. And 20% are considered active users. And active users defined as one login every 4 months. And so the patients who use them, the 15 million patients who are considered active users, are using their portal 3 times a year. And as you might be able to figure out, the most active portal users are the people who are most engaged in their care, active participants and already doing what they're supposed to. So you've got 15 million, give or take, patients using their portal very actively. And compare that to Facebook's 214 million users with 85% logging in daily, just to put that in perspective. So, you can say whatever you want. Patients really do like portals for refilling medications and for scheduling appointments. That's it. Nobody is going to take their health and wellness platforms that they use. And by the way, 95% of people in the US now own a smartphone, and 70% of that group has an mHealth app that they use regularly. People are not going to abandon their fitness trackers and their heart rate monitors and all the tools that they use. They're not going to toss those out the window and start using Epic instead, nor are they going to start uploading all of their data, into Epic and use that as a health and wellness platform. It's simply not going to happen. And with the proliferation of mHealth tools, I don't see how portals won't ultimately just go away. So again, that's my 2 cents, but it's based on a lot of things I've been reading. So the next thing, so all of that was about what I refer to as changing aptitude, understanding what engagement is and isn't. And the next step is taking a consumer-centric approach. And this can't be stressed enough. Healthcare is a service business. And, if you look at, I'm looking for my notes here because that's some stuff I wanted to stress. If you look at service industries and how they engage their clients and then look at healthcare, it's like night and day. So patients want to be engaged at their convenience. They don't want to download their MyChart app onto their phone. They don't want to have problems, and it's very inconvenient. Yesterday was dealing with a situation. I've been trying to have a prescription refilled for a week. I sent it in via MyChart. They didn't do it. It's not working. I was trying to send a note in when my wife and I were walking to dinner last night. I couldn't log in. I mean, it's ridiculous. You wouldn't have to do that in any other industry. They make it really simple for you. So providers need to start thinking of their patients as customers, not an inconvenience. And I didn't make that term up. I read an article that a fair percentage of doctors looked at patients as an inconvenience of their vocation. And again, patients have choices. They're leaving to find providers that cater to their personal preferences. And the older generation of physicians who believe in this sort of paternalistic style of care, I'll tell you what to do and you're going to do it because I'm a doctor, that just doesn't work. And patients are really disillusioned, and they don't view doctors that way. They view them as a partner to help keep them healthy, not as some lauded individual on a pedestal who's going to save their life. And having been out as a vendor in hospitals for 20 years, literally thousands and thousands of meetings, the hubris of healthcare, I never ceased being shocked at it. The attitude of we save lives, damn it. It's like, you're a podiatrist. I have a bunion. Like, you're not pounding on my chest, after a car wreck. Like, come on. And I'm sure there's a tiny fraction of neurosurgeons who can say, God damn it, I save lives. And, but most of them can't. Dermatologist removing a mole shouldn't make you wait 4 months for an appointment and then 2 hours in the waiting room. So, accepting where the industry is and where it's going, and understand that patients weren't built to engage patients. They can't, they won't. And the attitude of the industry has to stop being no. You explain to healthcare institutions, this and this. Well, we can't ask our staff to do one more thing. Everyone's overworked. Everyone's too busy. I'm sorry. I feel it, but it sucks just as bad to be a patient. And I'll give you another story. A couple of weeks ago, my mother had a stroke and was in the hospital for a few days, and they were going to move her to a rehab facility. And they called me at 4:30 on a Friday saying, we're going to move your mother. And I said, well, it's 4:30. It's getting dark and there's a snowstorm. And they're like, oh, no problem. We're going to grab her and she'll be there before dinner. They picked her up at 11:30. They dropped her off at midnight in a snowstorm. And this is a woman who's 93, had a stroke, and has dementia. So, when you hear about the level of service, everyone can complain about it. I do feel bad for people, clinicians. They are very put upon, but I didn't cause it. I'm just a patient, and I will go where the service is better. And then the last piece, when you take a step back, because it's going to require behavior change and all of this, but engaged patients benefit everyone. Fee for value is good for clinicians. I believe that primary care docs and nurses are the most underpaid people in America, next to school teachers. So they should be being paid more. I think their salary should be doubled overnight. And, an orthopedic surgeon shouldn't make $3 million a year when a PCP is making 175. That's wrong. Pay the primary care doc $300,000 and reduce the number of surgeries needed, and then you won't need as many orthopedic surgeons. But that's just my take. Next slide. Oh, sorry. So again, I don't want to read through all of these, but a few years ago, I gave a presentation and I was talking about the golden rules of customer service and how it compared to healthcare. And I couldn't get through the slide because as I was reading them, the people in the audience were laughing too hard. Because when you, and again, this is just sort of a snapshot of a few of the things that I found. You look at these golden rules of any service business, and that is put customers' needs ahead of your own. That doesn't happen. Respect people's time. Don't make them wait. Don't leave them hanging. When I go to the doctor, I make my appointments. I always book the very first appointment of the day because I don't want to be stuck waiting. I book the first appointment of the day. So I'm there early. I'm waiting. And the doctor's still usually a half an hour late. Like this, it's one thing to say, I was in surgery and I got held up, but it's like I made a 9 o'clock appointment. You've known about it for a month and you don't see me till 9:30. I don't understand that. But again, just looking at some of these rules, respond quickly with clear answers. Back to my drama of last night, trying to get my prescription refilled, which is now a week overdue. I finally got a call back from the office after I sent a note on my chart saying, if you're too busy to have me as a patient, please send me a referral to a different doctor. They called me and said, oh, they're having problems with their e-prescribing. Could I please drive to Evanston, which is 15 miles from the city of Chicago, and pick up a paper prescription? Because the doctor, her e-signature isn't working on her computer. And I said, no, I can't. So I don't know what's going to happen. Again, back to the golden rules. Appreciate your customers, show them respect, exceed expectations, invite feedback and criticism, accept your mistakes and learn how to apologize well. And again, this is a partial list, but for those of you who've been in and around health systems, would you say this is reflective of your culture? Okay, the next slide. So, I tee this up to explain, well, if your outcomes aren't changing, your patients aren't engaged. So in order to provide something of value, since you've all been on the phone, what I wanted to do is just sort of provide some guidance of what considerations should you keep in mind, whether you're going to build it, buy it, implement it, sort of adopt the philosophy. No matter what, these are all truisms in my mind. And in order to be an effective engagement platform, The considerations you need to have are, well, it's got to be consumer centric and built that way from the ground up. You can't repurpose something. All of the in-room TV vendors, they used to be entertainment platforms. They're now patient engagement platforms. And, they now partner with people, but they used to promote to health systems, we're a comprehensive engagement platform spanning the continuum of care. 3% of healthcare encounters take place in the hospital. 3%. So if the continuum of care ignores the other 97%, then yeah, that's a true statement. But it's television. They didn't have any content of their own. They would license it. So you have to have something that is designed for this. And whatever company you work with or people you engage with to help you create these things, you need a deep understanding of human-centered design, communication, methodologies, modalities, understanding health literacy. Every state in the nation, with the exception of one, I believe, has health literacy guidelines. And most of them are 6th grade and below. Utah is 7th grade. Maybe that's because Intermountain is there and they're so good. But, by and large, you're going to be communicating at a 5th grade level if you actually want to get people to listen. And also, you need to have a feedback loop or you need to care about outcomes. So you have to have as part of your core philosophy as a vendor, as a hospital, anybody who wants to do this or build it, that you care about outcomes, you want to measure and see if it's working, and you want to have a way to be able to incorporate feedback and results so that you're continually improving. So when I was doing this at Emmy, we would collect patient feedback. We would see where people would pause programs and have questions. We were constantly updating and measuring the results. Every industry does this. They're looking at how you shop, what your patterns are, what colors you like. They use analytics to do that. Healthcare should be doing it, but they're not. And you got to look at your engagement tools and approach and platforms to be reflective of how people are used to in being engaged, whether it's, traveling, buying an airline ticket, making a reservation at a restaurant, getting a haircut, anything, shopping online. It's made so easy. And healthcare, needs to adopt the same thing. And then again, to stress what I'd said earlier, trying to use ineffective tools and shoehorn them into something they weren't designed to do is a costly mistake. It's not going to change. So you're just throwing good money after bad, and you're delaying achieving the benefits of value-based care. On that last slide, I talked about when you're building an engagement platform, you have to be cognizant of engaging patients in their health in terms of the future of healthcare, where it's going to be, not necessarily where it is today. Everyone on this call is going to be a consumer of healthcare if they're not already. Hopefully nobody on this call is one of those super users who's hospitalized 4 or 5 times a year and have non-compliant whatever. But if you look at where healthcare is headed and everything's focused on wellness and prevention and keeping people out of the hospital, what are these other themes, and what platforms can support that? So obviously wellness, health, and preventative care. People use exercise trackers and Fitbits and all of that. You want an engagement platform that ties to that. Patient reported outcomes, hugely beneficial to the doctor. They make the doctor's life easier. They improve outcomes for the patient. And 90% of patients are willing to share their own generated data and their feedback with their clinician, but none of them are doing it on a portal. None. Well, less than 0.5%. So, providing patient-centered holistic care, incorporating alternative medicines and treatments, which is increasingly popular. People want to try, diet and exercise changes. They want to, I forgot the name of the field, but you have your blood tested and you see where you're deficient, what hormones you might need, or what vitamins you should take. Really, it's whole patient care. using all these mHealth tools and devices, patients want to leverage that information and look at it as part of their overall health. So your personal health information and your diet and exercise and lifestyle choices shouldn't be separated from your personal health record. But 99% of the time you're a consumer and 1% of the time you're a patient. So you shouldn't take your patient platform and expect to upload all your consumer stuff. You should use your consumer interface and expect your healthcare data to come to you. So again, these are lenses to look through when you're thinking of, can a portal support these things you see on the screen, and not can they, will they? So next slide. And this sort of wraps it up. So, where does patient engagement go from here? Well, the future of engagement is a single integrated interface designed around the needs of the consumer. Everything you need at your convenience and coordinated and choreographed to support your goals and objectives. Completely synchronized with your personal health record and your mHealth apps and your exercise and this and that, incorporating all of your, alternative treatments, medications, supplements, collects and shares your data with your clinician, any education you would need, prompts, reminders, all of that stuff. And to sort of put a bow around all of this, there was a great study that came out very end of last year. And that was Apple Computer did a study with University of Michigan for hypertensive patients. And they got 6,400 people with high blood pressure, and they gave them an Apple Watch. Now, most people test their blood pressure, they're supposed to test it every day. Maybe they do it once a week or only when they go to the doctor. The new Apple Watch is able to measure your blood pressure. So they had 6,400 participants, basically half men, half women, all different ethnicities, really a broad spectrum. These patients voluntarily were wearing their watches 15 hours a day. Those 6,400 patients, 6,400 individuals over the course of 90 days contributed automatically 1.1 million blood pressure readings. And 202 million heart rate measurements were collected in that period of time, with 107 million, 1.1 million reports sent up to clinicians. And when you put that in perspective to, like, I have hypertension, I take medicine, I go to see my doctor once or twice a year. These patients were measuring and reporting to their doctors 3 times a day. So it's orders of magnitude different than it is today. And that's really where the future of health and healthcare is. And by having these tools and apps and all of that, people will become healthier. Some a little, some a lot, but slowly we'll bend the curve and reduce the prevalence of chronic conditions. And that's what it's going to take to fix the broken healthcare system. With that, we can open up to questions or comments, or I could just stop.
Perfect. Jordan, thanks for running through. We actually had some very good kind of discussion. I think this is really resonating with a lot of folks. A few things in the chat. Gracielle mentioned that she's a coordinator in a patient support program and thinks patient engagement is absolutely vital in our field. However, it seems like it's a continuous challenge to find genuine ways to get patients engaged in their care. And there's lots of room for improvement, but she agrees that it's also a challenge to find platforms that truly engage patients.
Is that a comment, a question to respond?
More of a resonating, I think a resounding yes.
100% agree. And I would challenge one thing, and that is when she said it's difficult to engage patients. It's not. It's difficult to engage patients using tools that don't work. I mean, I can't tell you how many times I've heard from system executives, well, we have a patient portal for engagement. No, you don't. Like, I know Epic tells you that it does, but at the end of the day, are your patients uploading their data? Are they providing, patient reported outcomes? If the answer is no, they're not engaged. It's black and white. This is, like I said, we've entered the age of accountability, and you can track all this stuff. So, and ask your vendors, do you have outcomes? And if they don't have outcomes data, they're like, well, okay, you're a new company. Are you working on collecting data? Yes, we've got a study underway with the university of this, that, and the other thing. But companies that make patient education, which have for years, they don't have any outcomes data because it doesn't exist. So ask vendors for outcomes data, and every doctors will only recommend courses of treatment based on peer-reviewed journals, outcomes data. It's evidence-based medicine. Patient engagement should be exactly the same. Show me the evidence, what works. And again, I have lists, I'm holding this up, lists of studies. I found like 24 on blood pressure alone. So yeah, this stuff is out there.
Definitely. And you nailed it too, Jordan. Grazielle had a follow-up comment or question actually related to, you talked about interoperability. Her question was, would you say a significant part of the challenge is also related to the lack of interoperability between providers and their platforms? And as mentioned, there's so many engagement tools, portals, apps, et cetera, out there that can overwhelm patients.
So yes, lack of interoperability is a massive problem. Massive problem. And the example that I always like to use, I'm sure everybody on this call has a smartphone, right? Here's my iPhone, never far away. So when I went to buy this iPhone, I went to the Apple store and I bought it. I didn't say to them, wait, can I only call other iPhones? Or can I call a landline? I use T-Mobile. Can I call somebody on AT&T? Like, the assumption is, of course, with this phone, you can call any other phone in the free world. You probably can't reach North Korea, parts of Russia, but anywhere else on the planet, you can dial from your phone. And with an EMR, the assumption is the opposite. And they came up with the term, interoperability. That term shouldn't exist. You shouldn't have to have a term. It should just be done. There is zero technological barriers to interoperability. Zero. It's the EMR vendors. It's Judy Faulkner does not want you to have your own data. She's on the record saying, we invented interoperability. We're the most open platform that there is. And her view is, well, if everybody on the whole planet used Epic, data would flow seamlessly. That's not even true. I have 3 instances of Epic within the same health system. My primary care doc, my dermatologist, and the sports medicine guy I went to all made me set up Epic accounts, and they're all under the same health system umbrella. So yeah, interoperability is a problem, and it shouldn't be.
Definitely. So, sharing some other, I think actually, Frank, did you have any questions? I know you were having some audio issues there.
Well, first off, how bad is my audio? Because then
you don't sound like a robot. So everyone who was in earlier, Frank was a robot earlier. You missed it.
Yeah, the one other thing, and I love where Jordan's head's going, and I always get fired up to hear him. But the one other thing that I would say, and I think it was Graciela that mentioned this, it's the difference of, and he's right, we shouldn't talk about interoperability. That shouldn't even be a word that comes in, because no patient is really thinking about interoperability. They just want it to work. When somebody were to go and look for a car and do it via Uber, no one cared the technology that was behind it. They just said, that car is going to show up as soon as I hit the button. It's going to be there. It's going to take me from point A to point B. The difference that we're really trying to push, and you see the seismic shift in the healthcare system and what's starting to happen, is what we call going from inside out, which means from the provider out to the patient, which is the portals, which is the push, which is everything else, versus coming outside in, which is from the patient, controlling their own destiny, controlling their outcomes, controlling their data and everything else, and bringing that into the system. That is the difference. And they're going to do that via all the things that we've talked about, from apps to different connected devices to different patient engagement pieces, things of that nature. That's how that's ultimately going to drive it. Denise, anything for you?
Yeah, no, I was just looking at the question from, I think it's Pamela, about the patient-centric goals, and that is a huge role in determining outcomes, right? So certainly there's been a lot of legislative push on shared decision making, which is one of those things too that, like, you shouldn't need legislation to have shared decision making. The whole environment should be set up for that. And actually, it's a great place for technology to come into play and allow the patient to document their goals, think about it. Because sometimes when you're in that one-on-one environment, it's very stressful, right? If your doctor was 30 minutes late, now you're late forever. You needed to go. And so you just jump through, and maybe you don't ask the questions that you need to. And so if you can use technology and engagement platform to gather goals, to think about questions, and to really determine the care that is going to make it work for you, then you're 3, 10, 15 steps closer to engagement, because it's around what is important to you as a person rather than somebody giving you something that they've determined is important to you.
Absolutely. That lends to a comment Tawana made, that the feedback loops in healthcare, they're used to justify rather than identify what needs to be worked on next and where the resources need to go. The engagement questions are without true thought. It leads kind of to a question that we received earlier about how can engagement platforms impact care compliance?
Tremendously. And the data is out there. I can tell you, I happen to have a study right here. It was conducted by Tatana Davidson and Luke DeWhite, PhD, whatever. Effective engagement, among other things, improved behavior change, medication adherence, and in this study in particular, successful health intervention combined tailored messages, interactive communication, and multifaceted functions. Things foreign to a patient portal, but I have it on my Orange Theory fitness app that's on my phone. Like, this is not rocket science. Exactly. So yeah, medication adherence is a great example of a high impact, low cost thing to tackle with, these types of tools.
Frank, I saw you smiling and nod there. Did you have some additional thoughts?
Yeah, I think it's also, just to echo that, but it's around the gamification, right? Getting the patient engaged in such a way that they're used to doing that, whether that's innovative things like leaderboards, which doesn't sound like it's some revolutionary thing, but when they're part of an ecosystem and everyone else is really starting to do it, it drives engagement. You can start to gamify that through the app. And it's really clear that user experience and that user interface becomes paramount there to ultimately drive the behavioral modification that we're seeking. And you can do that through innovative things with like apps.
And realize the things that we're talking about are very common in all aspects of your life.
Exactly.
Healthcare is still in the Stone Age. Like I said, I've been trying to get a prescription refilled for a week. I sent a note in on my chart yesterday, no response. I called this morning. 4 or 5 hours later, they call me and asked if I could drive 15 miles to pick up a paper prescription. So all of these things we're talking about, medication adherence, they work. They're absolutely doable. It's the attitude of the industry. Could you imagine if you're flying somewhere, an airline calls you and said, our flight is down. Could you drive to the airport the day before and pick up your paper ticket? I mean, literally, this is it's funny until
if you're worse than an airline. That's really saying something, right?
Well, it's the standard.
I used to say a lot when I used to speak at a lot of conferences. I said that if terrorists ever wanted to bring down America, all they needed to do is install an EMR at the airport. Like if you had Epic at check-in, but baggage was handled by Allscripts, and the ticketing system was Cerner, and nobody talked to each other. And it's like, well, yes, it's your ticket, but it's on our system, so you can't have it.
Jordan, just tell us how you really feel.
Well, it's when I sold my company, I said one of the great joys I have is I don't have to pretend to like Judy Faulkner anymore.
There's no pretending, bud. There's no pretending.
That's great. Well, that brings us almost to the hour. I want to thank Jordan, Denise, Frank. Thank you for coming on. Did anyone have any final thoughts, things that we wanted to explore a little more before we kind of wind down?
Well, I would say to the people on the phone, if you're interested in this stuff, reach back out to our sponsors here and explain to them that, or ask them, to share with you white papers as they become available. But what we're all really interested in is understanding where you see the opportunities in your organization, because the people like me who are sort of on the outs, well, in the industry, but not having to be a vendor and sell into things, are able to theorize about what this could be. I love hearing from people who are on the front line saying, we got to solve this problem today. That's, how do we apply it immediately to help people get excited and see what it can achieve?
That's right. And our team's here to help, and we want to continue the discussion with you guys and let us know how we can be helpful, but we'll be in touch.
Definitely. We'll share a recording of this afterwards. Feel free, like Frank said, reach out to us. We would be happy to kind of explore this further, talk about your challenges, ideas, things that you've even had to be successful. We're here to partner with you. And speaking of partners, Jordan, thank you so much for being our guest speaker this afternoon. Thanks to all of you joining us on your lunch breaks or during a busy day of meetings. We appreciate your attendance. And look forward to connecting with you after this with some recording information. Thanks, everyone.
Thank
you. Have a good afternoon.
You too. Thanks, Jordan.